rich blood full of nutrients and oxygen to the rest of the body. And this blood is important for the function of all these other systems, so it's important. And so the functions are carrying food nutrients, oxygen, and other essential substances to all the body cells, transporting harmful substances from the body to excreting organs like the lungs and the large intestine, and protecting the body from diseases. So now the organs of the system. The first organ, the main organ of the circulatory system is the heart, and the heart has 4 layers. The epicardium, that is like the outermost layer of the heart, the myocardium, that is where we have the cardiac and muscle cells, and is where the contraction happens. Then the endocardium, that is the innermost layer, and finally the pericardium. This is basically like a bath that absorbs like all the shocks of the heart. The heart divides into 4 chambers over there, and are the atria, that are the upper sections, and the ventricles, that are like the lower parts that export the blood from the heart. And all these chambers are like separated by heart valves, and we have like 2 main heart valves: the atrioventricular and the semilunar. The atrioventricular is responsible to communicate the atria and from the ventricles, and the semilunar separates the ventricles from like each artery. And then we have blood vessels. So the blood vessels are like different channels that carry the blood throughout the body and the systems. And we have like 3 types. First, the arteries that transport oxygen-rich blood from the heart to the body, and then veins that are inner and move oxygen-poor blood back to the heart after its use. And finally, the capillaries. They basically allow the blood to be used, and also it carries the blood cells through like simple diffusion, and they're like so thin that molecules have to go through them like one by one. And the substance of this system is the blood. So the blood is like a fluid that is full of nutrients and a lot of substances. It's mainly composed of plasma, that it's like a transparent fluid. And it also has red blood cells that are like the concave cells, and they are red because of hemoglobin. Then we have white cells that are leukocytes, and they basically protect us from diseases and infections. And finally, the platelets, and they prevent blood loss through the activation and formation of blood clots, like anticoagulants in our system.
Okay, so now moving on to the diseases and treatment, starting with diabetes. Well, diabetes is the most common of diseases. It's caused by a high amount of sugar in the blood that cannot be processed because of a malfunctioning of the pancreas primarily, which does not produce insulin, in charge of destroying or using that sugar. It's one of the major causes of death worldwide, and some of its symptoms are elevated thirsting, dizziness, soreness, as well as long cicatrization periods, that is, the wounds stay open for a long period of time. And treatment, well, depending on the type of diabetes, it can be type 1, type 2. On type 2 diabetes, we need to inject basically insulin, as the insulin produced by the person is not efficient enough. So we have there needs to be an injection of insulin. Well, an insulin stimulating medication, so there's more insulin. And in type 1 diabetes, we do inject the insulin, as these type of patients don't produce insulin whatsoever. We also have angina. Angina is chest pain by the reduced flow of the reduced flow of blood to the heart. There are also various types, just like diabetes. It can be a stable or variant. Some of the symptoms are fatigue, nausea, fullness, and burning, or a burning sensation in the chest. Some of the common treatments are anticoagulant drugs, which help remove kind of any obstruction that is reducing the blood flow, as well as blood pressure and cholesterol medications, which also help to prevent those obstructions. There are also some surgeries and interventions, like the percutaneous coronary intervention, which is basically using a catheter to purify those obstructions, and also a bypass, which is basically removing those obstructing tissues. Also, coronary artery disease, also very common. It's due to a buildup of plaques in the walls of the coronary arteries that they are called plaques. This causes a reduced flow to the heart, which ends up killing some of the cardiac tissue, causing a malfunction of the heart. Some of the symptoms are angina, which is one of the diseases mentioned before, breath shortness, pain in upper extremities, and heart attacks. And the treatment, also similar, has to do with drugs that prevent those obstructions and any future complications, as well as certain surgeries that may help to physically remove those plaques. And then finally, arrhythmia, which is the disease that we're focusing on, is bad heartbeat. Basically, it could be lower than average, higher than average, or basically variant. And it's also related to, for example, the coronary artery disease. Some of the symptoms are chest pain, anxiety, and fainting. And treatment, there is really not much treatment that can completely cure it. It's more of certain machines that are used to prevent the heart from collapsing, like the pacemaker, which regulates the heartbeat, as well as some drugs and lifestyle changes, trying to do more exercise, eat healthier, and avoid tobacco or alcohol intake. And now moving just to the first part of our robot, well, starting with the technology. Technology advancements have also helped throughout time, or have already helped throughout time to help in this disease, to the creation of pacemakers, which, as mentioned earlier, are able to detect the bad heartbeat and correct it. However, even future technology like nanotechnology can help to improve upon these procedures. It can help these procedures have less complications. For example, pacemakers can cause certain complications on the surgery or the deterioration of the pacemaker itself. So with improvements in technology, we can have longer lasting batteries or better procedures to avoid complications. And our vision, what we want would like to be able to create is a tiny robot that would be injected intravenously. It will travel through the veins and into the basically this robot will travel entering the heart. In the heart, it will do certain shocks to the heart, serving as a pacemaker, which will be able to monitor and correct the incorrect heartbeat. And yeah, it's basically that. That's the idea.
This table is very heavy.
Okay. Now the pros of the robot, we have that it have its own battery, so it can last several months inside your body. Um, the robot also can help people with arrhythmia, angina, CAD, and another type of cardiovascular diseases. Compared to other methods, it's less risky and can regulate the condition of the heart. Okay. Okay, continue with the 3D model. This is it. We started with this. This is the rod. It will be introduced by the vena, and it will go through your heart. This is the robot that we use for the practice, and this is the circular system that we used. In there we that's it, actually.
Program.
The big one.
Program.
Program. Okay. Yeah. This is the algorithm and that we used for the program of the robot. The videos are here. These are
I didn't connect the internet. Okay.
okay. Well, is the product, the Logic programmation program. There, the steps for the algorithm already mentioned them. The video is short because we don't have internet. This is the product. And over here we have the function of each button of the control of the motor.